Welcome future nurses to LPN LaunchPad's quick reviews. This presentation covers fluids and fluid balance. Understanding how the body maintains homeostasis is critical knowledge for the NCLEX. Today, we will explore fluid functions, compartments, types of IV fluids, and clinical applications to highlight the essential roles of water in the body, including transport, metabolism, and regulation. We will also discuss why specific populations, such as infants and older adults, are at a greater risk of fluid imbalances. Water is essential for transporting nutrients to cells and removing waste products. These processes ensure that each cell has the energy it needs to function while keeping the body free of metabolic byproducts. Water is a solvent for biochemical reactions, enabling essential metabolic processes like energy production and nutrient synthesis, and ensuring optimal cellular function. Water helps maintain the body's acid-base balance by supporting buffer systems. It also plays a critical role in regulating body temperature through heat distribution and sweating. Infants are particularly vulnerable to fluid imbalances due to their higher body water percentage, about 70-80% of their body weight. Their immature kidneys are less efficient at conserving water, and their higher metabolic rate leads to rapid fluid loss. Reduced thirst perception and declining kidney function in older adults make dehydration a common concern. Their lower total body water percentage also increases the risk of fluid imbalances, emphasizing the need for vigilant monitoring. Next, we will explore fluid compartments in the body. Intracellular fluid is found within cells and is critical for metabolism, while extracellular fluid includes intravascular, interstitial, and transcellular fluids, all of which play distinct roles. Intracellular fluid is fluid inside cells, making up 66% of the body's water. This compartment is vital for metabolic activities, and potassium and magnesium are the primary solutes that help maintain cellular balance. Extracellular fluid accounts for 34% of total body fluids and divides into three components: intravascular fluid, the plasma within blood vessels, interstitial fluid, which surrounds cells and tissues, and transcellular fluid, found in specialized spaces like cerebrospinal fluid. The fluid exchange between compartments is essential for maintaining homeostasis. Osmosis enables water to move toward areas with higher solute concentrations. Diffusion allows solutes to travel from high to low concentrations, and filtration relies on pressure gradients to drive fluid movement. This section will examine how the body regulates fluid balance through the thirst response, kidney function, and hormone regulation. We will also investigate daily fluid intake and output as a measure of homeostasis. The body regulates fluid levels using several mechanisms. The thirst mechanism, triggered by hypothalamic osmoreceptors, signals when to drink. The kidneys adjust fluid retention and excretion. Hormones like ADH, aldosterone, and ANP work together to maintain fluid balance by controlling water and electrolyte levels. Fluid intake comes from three primary sources. Oral fluids provide approximately 1,200 milliliters daily. Food contributes about 1,000 milliliters daily, and metabolic processes add another 300 milliliters. These sources total around 2,500 milliliters daily, meeting the body's hydration needs. Normal fluid output mirrors intake, with urine accounting for about 1,500 milliliters daily, skin and lung losses, or insensible losses, totaling about 850 milliliters, and feces contributing an additional 150 milliliters. This balance ensures the body maintains hydration and waste elimination. Dehydration occurs when fluid intake is insufficient or fluid losses are excessive. Common causes include vomiting, diarrhea, or inadequate oral hydration. Dehydration is especially dangerous for infants and older adults who can less compensate for fluid deficits. The symptoms of dehydration include thirst, dry mucous membranes, hypotension, tachycardia, and fatigue. Recognizing these early signs is critical to preventing further complications. Overhydration results from excessive fluid intake or conditions like renal failure that reduce the body's ability to excrete fluids. To prevent fluid overload, monitoring patients receiving IV fluids is essential. The symptoms of overhydration include edema, elevated blood pressure, crackles in the lungs, and jugular vein distension. These signs warrant immediate intervention to prevent further complications. Key assessment techniques include daily weights, where a 1 liter change equals about 2.2 pounds, and monitoring intake and output. Additionally, checking skin turgor, mucous membranes, and urine concentration can provide valuable insights into a patient's fluid status. This section will review the three primary categories of intravenous fluids: isotonic solutions, which expand the extracellular fluid volume; hypotonic solutions, which hydrate cells by moving water into them; and hypertonic solutions, which draw water out of cells into the extracellular space. Each type has distinct clinical applications that we will examine. Isotonic solutions like 0.9% normal saline and lactated ringers expand extracellular fluid volume without causing fluid shifts. They treat conditions like hypovolemia, dehydration, and surgical fluid loss. However, these solutions can lead to fluid overload in patients with cardiac or renal issues, so caution is needed. Hypotonic solutions, such as 0.45% normal saline, move water into cells, rehydrating them. These are ideal for patients with intracellular dehydration, such as those experiencing hypernatremia. However, hypotonic fluids should not be used in patients with increased intracranial pressure or burns, as they can worsen edema. Hypertonic solutions, including 3% normal saline and D10W, pull water out of cells into the extracellular space. They are used to treat severe hyponatremia or cerebral edema. Due to their potency, hypertonic fluids require careful administration and close monitoring to prevent complications like cellular dehydration. Effective assessment of IV fluid therapy involves monitoring the infusion rate and evaluating for signs of complications. Watch for fluid overload, such as elevated blood pressure or lung crackles, and inspect the IV site for signs of infiltration or infection. Document all findings to guide ongoing care. To summarize, the clinical applications of IV fluids are as follows. Isotonic solutions restore extracellular volume during fluid loss. Hypotonic solutions address intracellular dehydration. And hypertonic solutions manage severe sodium imbalances or cerebral edema. Always match the solution to the patient's specific needs and conditions. Fluid movement within the body relies on both passive and active mechanisms. Passive transport includes osmosis, diffusion, and filtration, which occur naturally without energy expenditure. Like the sodium-potassium pump, active transport processes require ATP to move solutes against concentration gradients, maintaining cellular function. The following assessment findings indicate successful fluid therapy, improved skin turgor and moist mucous membranes, stabilized blood pressure and heart rate, and balanced intake and output. Continuous monitoring ensures that the treatment achieves its intended outcomes while preventing complications. Signs of fluid overload include edema in the peripheral tissues, increased blood pressure, crackles during lung auscultation, and jugular vein distension. These symptoms necessitate immediate interventions to avoid worsening the patient's condition. If fluid overload is detected, the following interventions are essential. Slow the IV infusion rate to reduce fluid administration. Administer diuretics to eliminate excess fluids, as prescribed. Monitor the patient closely for further signs of overload and adjust care accordingly. Early intervention is key to preventing complications. For the NCLEX, focus on mastering the following key points. Understand the functions of water in the body, including transport, metabolism, and regulation. Recognize the differences between isotonic, hypotonic, and hypertonic IV fluids and their clinical applications. Identify signs of fluid imbalances and understand the appropriate interventions. Practice NCLEX-style questions to reinforce this knowledge and gain confidence. Question: a patient receiving IV fluids develops crackles in the lungs, jugular vein distension, and edema. What is the most appropriate initial action? Options: A. Administer a diuretic. B. Slow the IV infusion rate. C. Notify the healthcare provider. D. Increase oral fluid intake. The correct answer is B. Slow the IV infusion rate. Rationale: slowing the infusion rate is the first step to prevent further fluid overload while continuing to monitor the patient. Reassessment may lead to recognizing the need for additional actions, such as notifying the healthcare provider or administering diuretics. Question: which IV solution is most appropriate for a patient with severe hyponatremia? Options: A. 0.45% normal saline. B. 3% normal saline. C. D5W. D. Lactated ringers. The correct answer is B. 3% normal saline. Rationale: Hypertonic solutions like 3%, normal saline pull water out of cells and into the extracellular space, correcting the severe sodium deficit. Due to their high concentration, these fluids require careful administration and monitoring. Question: a patient is prescribed a hypotonic IV solution. What is the expected therapeutic outcome? Options: A. Increased intracellular hydration. B. Decreased extracellular fluid volume. C. Correction of hyperkalemia. D. Reduction in cerebral edema. The correct answer is A. Increased intracellular hydration. Rationale: hypotonic solutions move water into cells, rehydrating them. They are particularly effective for treating hypernatremia, where intracellular dehydration occurs.
Hey there, this is Brian. I am the creator of LPN LaunchPad. I want to say thank you for learning with us. In addition to these videos, I've created a series of free adaptive quizzes in ChatGPT. The link to this video's quiz will be listed in the description below. Help me keep this project alive by hitting the like and subscribe buttons.